Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. Now, the questions you'll want to think about for your treatment when you meet with your team and they offer a treatment plan for you is you'll want to think about and look up what is the standard treatment for my type of cancer and my stage. Is this the only option? Are there other options? So you want to get a little bit familiar with it so you can understand why this particular treatment was decided for you and you feel comfortable about it. So you'll want to figure out what are the risks and benefits of these treatments. So as in, if we are given this treatment, what are the chances of this treatment helping with addressing my cancer? Is this a curative treatment, or is this a treatment for maintaining the pain or just keeping the tumor mass stable? So you'll want to understand, is it curative treatment? Is it palliative treatment? Is this a treatment that you need to take for the rest of your life? So you'll want to understand those kind of things about your treatment. When does the treatment need to start? And how often will you need to take that treatment? Is this the treatment that will be given to you where you come to the outpatient center and get your treatment and go home the same day? Or is it something that you need to be in the hospital? Or is it something that you are given the treatment and then it's like oral chemotherapy, you're taking it at home on your own and you're coming back for a visit? Those are the kind of things you'll want to find out. You'll want to understand chances of recovery, as in, is this first line treatment? Is the second line treatment? What is the goal of the treatment? So if it's successful, then what is the outcome we can expect from this treatment? Is there any data on this? Generally, they'll be able to provide you with some links and information on this. How do you know if the treatment is working? So for example, is it that, you'll see your CA-125 marker is improving, or is it something else? So how do those lab values connect to your outcomes? So how are we seeing that that the treatment is working, we are accomplishing the outcome? So those are some things that you may want to figure out. I think we have some more education and videos about these different labs and biomarkers as well for understanding whether the treatment is working or not. So you can go check out that video. You'll want to understand that because then yes, okay, the treatment is working, or it's a little slower than what's expected, or if it's not, then is that why the treatment regimen or the plan is being changed or something is added on. So those are some things that will help you. Also, of course, you'll want to understand what are the risks and benefit with this treatment. That's a really important point I want to stress on. And that's because I think I see both sides to it. I see that sometimes we're just thinking about, okay, this will really help me, and we are going to get that treatment, but we haven't thought through the side effects that are going to be involved with this and prepared for that well enough. So how physically debilitating it could be, or emotionally, or the fact that you might not have energy, or taking time off from work. So again, we are doing this treatment because it's going to help us with managing that cancer, with hopefully getting rid of that cancer. But we also need to be prepared for what are the side effects associated with it. Because when we are prepared, then we can have better outcomes. So we are not thrown off, right? So important to keep that in mind. At the same time, it's don't let it freak you out. Don't let it scare you so much that you're choosing to not go for your treatment. We take care of so many patients, at least, in my profession, we are taking care of so many patients every single day. Hundreds and hundreds of patients per week are passing through our center, and they are all going through the treatment, and they're hanging in, and they're doing okay. So sometimes, fear of unknown can be overwhelming. So talk to somebody about it. Think about what is it that you're afraid of. Talk to someone about it. Sometimes our fears are bigger than the the actual issues. Okay, so talk through it with somebody and make a plan so that you're not letting your fear affect your chances of survival, the best outcomes that you can get. All right, so do think about the side effects and the risk associated with your treatment. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.